My name is Brianna Graham. I'm a master of public health student at the University of The specific aim of the study is to assess the association of body mass index and sugar-sweetened beverage consumption. Our target population is only New York residents. Data for this study will be generated from the 2016 Behavioral Risk Factor Surveillance System. BRFSS is a cross-sectional survey that looks at health-related risk behaviors, chronic health conditions, and use of preventative services among adults 18 years of age or older. It is conducted nationally and also in participating territories. It is issued annually by the Center for Disease Control. The survey uses random digit dialing to call participants and collect self-reported data. Again, for this study, only New York residential data was analyzed. The behavior risk factor surveillance system variables include sugar-sweetened beverages consumed, sex, age, Hispanic, race, education, income, physical activity, cardiovascular disease, and diabetes. Stata Statistical Software version 15 was used during this study. The outcome of interest is BMI calculated as kilograms per square meter. Data cleaning for this study included individuals who were underweight with a BMI less than 18 and a half, and individuals who were severely obese with BMI over 40 were excluded to eliminate confounding variables. These variables include potentially high unusual eating habits or other health phenomena. Sugar-sweetened beverage consumption was then cleaned to include different categories of 0 drinks, less than 1 drink, 1 to 7 drinks, and then more than 7 drinks per week. These beverages include fruit drinks and sodas that were sweetened with sugar. This study also used complex survey weighting. This is a technique used in survey research to produce nationally representative estimates of all subgroups, even when they make up a small portion of the study sample. This process is done to reduce bias that can arise from very small sampling frames. This study then checked assumptions by using Stata to produce CPR plots, residential plots, and QQ plots. No violations were found from generating these plots. The study then used simple and multiple linear regression to assess crude and adjusted association between sugar-sweetened beverages and BMI levels for New York residents for 2016. After data cleaning was performed, it generated 22,572 New York residents. Of those residents overall, the study consists mainly of white men with a mean age of 48. Of those men, 36% graduated high school or less as an education level. 54% had an income of at least $50,000 a year, and 23% participated in physical activity within the last 30 days of the survey. Looking more exclusively at the obese participants, 70% reported that they had consumed at least one sugary beverage per week. 43% graduated high school or less as an education level, and 70% did not participate in physical activity during the last 30 days of the survey. Data generated from the unadjusted and adjusted linear regression showed that BMI has a 0.47 positive association with the consumption of 7 or more sugar-sweetened beverages per week. It also showed a strong negative association of 0.82 between BMI and college graduation. It showed a strong positive association of 0.73 between BMI and no physical activity, and a strong positive correlation of 2.4 between BMI and previous diabetes diagnosis. In conclusion, the consumption of sugar-sweetened beverages has an association with BMI levels in New York residents for the year of 2016. This research showed possible risk factors for obesity include sedentary lifestyle, sugar-sweetened beverage consumption, and a previous diabetes diagnosis. It also suggests education level as a protective factor. Further research is warranted into these conditions. My proposed research intervention is titled Leverage Your Beverage. It is designed only for New York residents at the moment. It will focus on a balance between money, nutrition, and physical activity. It is based on the social ecological model. Possible partners for this intervention include the New York State Department of Health, the Obesity Prevention Program of the New York State Department of Health, and the University of Rochester Medical Center. Research also shows that they have developed a sugar-sweetened beverage toolkit, which displays consumption and weight gain association to the public and helps them understand it better. In order to participate in this intervention and to eliminate bias, initial weight must be taken by a researcher in the program or by a physician, and proof must be submitted with physician signature by the app. The cell phone app will also send notifications. Notifications include coupons for healthier food and drink options. It will also include daily tips for exercise. It can use the GPS location on any phone to recognize geographic safe zones. So places that people may not realize can be used as walking areas can then be alerted when they are in the area. The app will also host community challenges in which participants can enter their walking distances and also pictures of healthy food and calorie consumption to be calculated into totals as part of a game. These games can either be community versus community or participant versus participant. In relation to the social ecological model, the individual determinant level is affected through the daily tips for exercise, the self-reported and physician-reported weight, as well as app games. The social environment is impacted through coupon notifications for healthy foods and drinks, self-reported and physician-reported weight, and app games. The built environment is affected through safe zones, notified through the app, as well as community support and app games. Evaluation methods for this intervention include self-reported activity levels during the program, self-reported weight during the program, and final weight taken by a physician with proof and signature and entered through the app, or final weight taken by a researcher of the program. These are the references used for this study. Thank you for listening to my intervention and the study conducted during this course, and I hope you have a nice day.